In this video, I'm going to be showing you my technique on how I manage rotating and non-rotating heminucleus. Now, when we have one heminucleus left, we usually use our phaco-tip or chopper to rotate the heminucleus. That way it's directly facing the phaco-tip so that you can proceed with chopping or sculpting. But I'm going to show you that you don't need to do this extra step where you rotate, then proceed with surgery. With this technique, the surgery basically gets rid of rotation altogether, and that has some utility. First of all, by eliminating one step, the surgery is quicker. There's benefit specifically in posterior polar cataracts because nuclear rotation can put stress on the posterior capsule, which is very delicate in posterior polar cataracts. And by eliminating the rotation, it has utility in these cases. Also, when you come across a case where you have trouble rotating a heminucleus across, it usually may signify loose zonules or corticocapsular adhesions. And so with this technique, you don't need to rotate because you're going to proceed the surgery without the need for rotation. So it has utility in loose zonules. Now the technique overall is conducted under position 1. That means that there is no vacuum, that there is no aspiration being used. And so the heminucleus will be bisected entirely with mechanical forces. And so it's efficient from an energy standpoint and therefore has utility in compromised corneas where you want to basically reduce the EFX. The sequence in its entirety is on position 1, and so the posterior capsule is tented way back because you're constantly on irrigation, which is position 1, and you're not using any aspiration or vacuum. So to do the technique, I'm going to show you with basically this pen and pencil here, and then I'm going to play the video. That way you know exactly what to do. So again, you've got the residual heminucleus. You do not need to rotate it across. What you're going to do is step 1 is you're going to use the chopper to gently nudge the heminucleus towards the center. And then step 2, you're going to then use the phaco-tip to do the same thing. What you're basically doing is slightly nudging this heminucleus towards the center. Why is that? This will provide some space for the chopper to wrap around to the edge of the heminucleus. And as it does that, it will bisect the endonucleus from the epinucleus. So step 1, push. Step 2, push some more. The heminucleus will move towards the center. Then you're going to use the chopper to wrap around, and now you're around the heminucleus. And then the phaco-tip will go here. And what you're basically doing is you're going to flip the heminucleus, which is here. You're going to flip it this way simultaneously with the two instruments. And so once the heminucleus is now on its opposite axis, you're going to then sandwich the heminucleus by bringing the two instruments together. And this will break apart a soft cataract, a moderate dense cataract, and an extremely dense cataract. So I'm going to start the video here. So here comes the chopper, nudge, phaco-tip nudge, move the piece, wrap around. There's the endonucleus and epinucleus. Bring the two instruments together and you've noticed the bisection there. So again, nudge, wrap around with the chopper, bring the phaco-tip around, and you've got your complete separation there. So it's entirely on position 1. The posterior capsule is tented way back during this whole sequence because you're entirely on position 1. There's no surge with this technique. You can see the chopper dissecting the endonucleus from the epinucleus. And again, with the absence of ultrasonic energy, it demonstrates energy efficiency. So for me personally, for all my cases, whether the heminucleus rotates or doesn't rotate, I proceed with this step. To me, it makes sense to just go ahead when the heminucleus is right next to the phaco-tip. By moving it across, you're actually moving the endonucleus away from the phaco-tip. And so with this technique, once you get comfortable using it, you'll find that your surgeries, especially during in terms of nuclear disassembly, your surgery will be quicker. And then you'll have benefit, as I mentioned, with posterior polar cataracts, loose zonules, and then in cases of compromised corneas where you want to basically limit the EFX. That's basically the technique. I have other videos. Several people have private messaged me asking me to kind of break down the technique again. And so I hope this was useful to you. If you have any questions, you can always private message me or if you have any other questions. Like I said, I've had a lot of people ask me about this technique. A lot of people have tried it out with much success. It does have a learning curve like all techniques, but once you get the hang of it, you'll find that this step of the surgery is much quicker. And more importantly, it's not just about speed, but I find that it is just safer. If you've got a heminucleus and you're trying to rotate it and you're having resistance, then you're stressing the zonules. In this case here, you're basically freeing up the endonucleus and epinucleus from the capsular bag entirely. When you rotate pieces, you're stressing the zonules. So I find that in specifically challenging cases, this technique is quite useful. Anyways, that's the video in a nutshell. Thanks for your attention, and I'll see you on the next video.